Welcome to another edition of the Ministry of Health's Weekend Review. On Monday, Minister Dr. Frank Anthony met with a delegation from CARFA to discuss an integrated capacity building mission for mass gatherings in Guyana. Thereafter, he attended the opening of the Allmac Medical Hub in Region 3, which will offer dialysis treatments, urgent care, podiatry, radiology, dental care, among other services. This facility is modeled after the Brookdale Hospital Medical Center in Brooklyn, New York. In addressing those present at the opening ceremony, Minister Anthony highlighted the positive impact of such investments on quality health care and medical education.
And in Guyana, we have had a lot of our skilled people who migrated, whether to the US, Canada, UK, to the Caribbean, to different parts of the world, where sometimes we don't have our own very best to be working in some of our hospitals. With these types of investment, we are now changing what was a brain drain to a brain gain, where persons like Dr. Mark Forson and his team is coming back, not only offering good quality health care, but also would be involved in teaching, because we need excellent clinical mentors to help our doctors and nurses so that we can live the quality of care that we're offering to our patients.
On the following day, the Ministry of Health commenced a 3-day radiation emergency simulation workshop to finalize the National Response Plan with stakeholders' input and to familiarize participants with the emergency system roles and responsibilities. The Health Minister, in his remarks, highlighted the importance of the new radiation safety law, emphasizing the health sector's use of radioactive isotopes and the need for strict safety guidelines.
In the health sector, we are one of the primary users of radioactive isotopes, and we use that in some of our imaging equipment. We use that in the way that we treat some patients, because as part of their treatment regimen, they require radiation treatment. So this is using it for medical purposes, but this is not the sole use. You have these isotopes being used, or different ones being used in mining. You have some of it being used in the oil sector. And there are different threshold levels and so forth, exposure. And all these things we have to look at. And the legislation, you would see that there are standards in there. What are the thresholds that we need to meet? And I hope that this would serve as an occasion where you can review some of these things.
Over this past week, several mosquito bed nets and hammock nets were distributed to the health facility in Sabai, a referent community in the Matarkai sub-district of Region 1. Additionally, to commemorate Mosquito Awareness Week, a school education and sensitization session was held at various learning institutions across Georgetown to educate students about mosquito-borne diseases and emphasize the importance of individual actions in prevention. While the Ministry of Health continues to make strides in promoting good food safety practices across all sectors, a training session was held recently for all tourism and non-tourism focused businesses that deals with food preparation and water safety. This collaborated effort between the Health Ministry, CARFA, and the Ministry of Tourism saw the participation of 184 persons who were edified in preparing and handling of foods, wash station measures, wash protocols, temperature regulation for foods, beverage handling, and safety measures as Guyana prepared for the ICC Men's T20 World Cup. This wraps up this week's highlights. Remember, hypertension is a killer. As such, you should have regular checkups, maintain a healthy diet, and exercise regularly.